I've kind of hit on all of this. So you know what, the AT&T guy though, if I'm a big employer, I don't have to pay this $2,000. I can just say I've got coverage. It's not affordable to the population that I know we're all talking about. You know, the ones that make 20, 30,000 on down, they're not going to pay $100 a month.
So the definition of affordable is 9.5%.
9.5% of that person's annual salary. So
Of that person's
household income, but nobody's, the safe harbor for the employer is to judge it based on the employee's income currently. But you're right, the legislation says household income, because so that's even bigger. They can't afford it off the 10% off of the 20,000. So I think there's still going to be a lot of people going, I'm not interested. And who knows what the future of that is. So full-time employee, we talked about that. A lot of people, even in the article today, and these, a lot of part-time people are going to be upset by that because they want the income, they don't want the insurance, but they want to be able to work. So, like Long Beach is saying, we're going to cut you down to 27 hours. Just not a solution. And probably the largest restaurant group that I'm referring to, that's not even on the table discussion. Most companies are just not considering it. Although I heard some people say, hey, McDonald's and other companies say, I'm out of the healthcare business, see ya, you guys can go, we'll pay the penalty. Then there could be many more big companies that do that. And a lot of companies would go, hey, $2,000 an employee, it's cheap. Cheap, it is cheap. I'm not too worried about this. A lot of people are. There's another fee coming. It's called the Cadillac tax. Ron, I mean, other people seem to be alarmed by this. I am not at all, because I think we can make adjustments to it. So I'm not worried about this tax. If anybody pays that tax, I would be surprised. Okay, that's if you have too good of a plan by by their determination, by 2018, too far away, considering what this legislation is, then nobody's going to pay that tax, and I'd be willing to bet a lot of money on that. Thinking ahead, tools available. So this is just some of our stuff to tell the employers that we make this presentation to. So in a nutshell, it's moving every week. It's very hard for big organizations. We're meeting with our clients right now that are 1/1 renewals, that are spending $1 million, $2 million, $3 million, $4 million for their health care. And they're asking us to tell us we need to do our budgets. And it's not that easy. Without this legislation, we could tell them plus or minus 2 or 3%. With the legislation and the knowledge, the lack of knowledge of how many of their employer population is going to want to get on the plan, jump on the plan, not be on the plan, it's just kind of a moving target. That's the difficulty for the American workforce, not the workforce, but the companies today. But it moving weekly, and I don't know, Ron, when I don't know, you were here, do you think that there's a possibility of a delay of enforcement? Is that talked about at the circles at Blues? Because of political?
It's always a possibility. However, there's such a strong push for credibility from the administration to make sure that this thing is ready to go and up and running. And sure, we can take a hit on a few glitches, but by and large, the program should go forward. But Mark, I'd make one other comment with respect to this defined contribution. Some of us around the room remember 30 years ago when IBM made the conversion from defined benefit to defined contribution and pensions. The health benefits will be something else. The light's been turned down. Light bulb's been turned on with respect to ACA, and now employers will be able to offer it, but convert it into defined contribution and budget for it.
Perfect.
Let the employee then suffer the burden of exchange activity itself.
Exactly. There's fees that I didn't even mention, but the $63 per belly button fee, per person fee. That's not per belly button, is it? Per belly button. So companies have to pay $63 per belly button next year in their firms, and then they're going to pay $1 now, or $2 this year, $1 this year, $2 next year. There's other fees that are built into this that are not insignificant. So you were going to mention.
Yeah, actually, as a another dynamics is as a part of this accountable care now they are actually focusing the shift on the physicians like Medicare management of the Medicare. Actually, they started giving licenses called accountable care organization. It's owned by the physicians, you know. So the money they save to the Medicare, the doctors are getting the incentives. They're given over 100,000 licenses for the doctors to actually control the Medicare patients, you know. Like every patient has say $10,000 a year, and if you actually, the money you save, and that money goes to the physician groups instead of the insurance companies.
So he's being paid commission for
Reducing-
not treating or
You know, saving money,
yeah, saving money.
not sending
That
not
has-
sending the patient to the ER and
Yeah.
you know. So right now there's no incentive. So
Yeah.
that's they're given hundreds of licenses across the country now. ACO.
Last little comment is, I haven't mentioned the one thing, the biggest driver of our healthcare dollar is maybe not anything that I've said here today. It is that in America, unique to our country, is our poor nutrition habits, let's say it that way, and alcohol and drug addiction. So, would you agree, Ron?
Yes.
That 50% of our healthcare spend is because we're awful at what we eat, and we eat drugs and alcohol, unlike the fine nutritional country that.
Yeah, I won't hold myself as an example, but I want to please join me in giving a round of applause to Mark for his obviously, this is a very complex topic, and what we were trying to do today was to kind of highlight kind of some of what we know and most of what we don't know. And really, there is a lot that we don't know. And the idea would be to kind of highlight things that we need to be concerned about, both as employers and as as employees, in a manner speaking, about things that we need to be sensitive to as this legislation rolls out, this next few years. I thank you for your patience being here today. We're going to be around here to answer any questions. Mark is going to be around answering any questions. I'm going to seek your indulgence for a minute while Brad talks about his latest project for multifamily. So this is a brief advertisement moment. So please.
It's absolutely blatant advertising. Thank you all for being here this morning. Medical is certainly my favorite topic of the day because our newest apartment community at Encore Multifamily is under construction on Maple Avenue, just around the corner from the new Parkland Hospital and also from UT Southwestern's teaching hospital. Found out recently that this is the largest medical project under construction, not just in Texas, not just in the U.S., but in the entire world. $2.5 billion, 15,000 new employees coming to the area over the course of the next 18 months. So the demographics are pretty compelling. I had the opportunity yesterday to tour our competitors, our next door neighbor who's completed their lease up about 6 months ago, and the competitor across the street who's in the middle of their lease up, to gain some ideas. Property management people are so wonderful. I mean, they're so honest. They'll tell you exactly where the developer screwed up, what they would have done if it were their money, and how I should do next door, okay? So it's wonderful to get that input, and it validates some of the fit and finish and the amenity package that we're supplying in our project, and gave us some new ideas as well. One of the more interesting things, and the things that I'm really glad to report, is that their rents are much higher than our pro forma rents. So they've been able to establish a very high watermark in rents that should make our investment very profitable. Next door just sold to a large apartment REIT, Emily, out of Chicago, for a sales price of $155,000 per apartment unit, $185 per square foot. We have a flyer for you to take with you. Our all-in cost is $111,000 per unit. So I think the chances of our success financially are very good. We've been into our equity raise. Daisy Chen is with us this morning. She's in our equities group. We've been in our equity raise now for about 3 months. And out of the $9.5 million that is required from the limited partners, because we put in 10%, which is a little over $1 million, we've raised about 7.5. So we're at the tail end of a raise, $2 million. Surya, thank you for your investment. We appreciate your confidence in Maple. We think you're going to be a happy investor, and Be happy to answer any questions you might have about that.
This is, since you are creating jobs, so it's going to come under EB5 or no?
This will not be EB5. Now, what the jobs I'm talking about are all hospital-related jobs, 15,000.
But
In the
still
apartment,
actually that, so many jobs are created.
Yes.
This is too late to be an EB5.
It won't be.
yeah. So
Do
this
you
is,
know,
this is conventionally financed.
What they'll be doing to the existing apartment building? That still stays?
You know, I don't know what's happening to the existing apartment building, frankly. I apologize. I just don't know that. You know, we're so excited about the new building, we're not sure what the old building's going to be. I don't think it's going to be abandoned. I mean, the old Parkland, as you know, was renovated into the headquarters of Crow Holdings, the Trammell Crow family company. I'm sure they'll find good use for it.
What is, I'm sorry.
Yeah, go ahead.
What is the expected start completion date?
Well, actually, if you drove by there today, you would see that our parking garage is almost finished. So we started construction on November 15th, and how these 4-story wraps, is the lingo that we use for them, are built, is you build the parking structure in the middle first, all concrete parking structure, and then you build the frame apartments around it. So if you went out there today, you wouldn't see a stick of lumber going up as far as framing on the apartments just yet. We're about 3 weeks away from that, but you'd see the parking structure in place.
Was your project going to be the higher amenity project compared to the other two? Or are you going to be in the middle of that, or just, I'm curious?
We are going to be comparable on certain amenities, such as the fitness area, the conference room, the business center, those kinds of things. There's a well-worn path of what you do in those areas. Our pool's going to be the nicest. Okay, our courtyard's going to be the nicest. Our landscaping will be the best. Our architecture is going to be very, very unique. In Dallas, you see plain old brick, stucco, shingle roofs, blah, blah, blah. You're going to see something very special about this architecture. So it'll be very compelling. We'll have a 2-story glass storefront that'll be very, very unique to the area. We'll have a porte cochere, which is really, you only see in high-end condominium projects. A water feature inside the leasing office, so when you drive by at night, you'll see a lit water feature. You'll want to come back when we open the next day.
What was the average rent be?
Average rent's a little over $1,000 a month. The average unit sizes are in the 750 to 80 range, mostly 1-bedrooms. Our research over the years, and my 35 years of experience, has taught us that medical employees are studious people, they're smart people. Typically, roommates don't work for that reason, and the reason that they work all crazy hours, it's hard to have a roommate. So 75% 1s, 25% 2s, no 3s.
Is the investment, I don't know what other term to use, but cash out, is it only when you sell it, or what are?
No, there's cash flow opportunities once we get the property built, stabilized. Then there'll be a preferential return of 10% of your investment that starts from the day that you put your money in. So we've had investors that have been in for 3 months that are clocking that 10% preferential return, although right now there's no cash to pay it because we're under construction with no revenues coming out.